another. I'm Debbie with Help for IBS, and I happen to be in Scotland right now. Go ahead and make a comment below. Let us know where you are hearing us from. We'd love to see that. And I have Heather here for another AHA, Ask Heather Anything. Our topic today is Eat Without Fear, Live Without Fear.
IBS is literally a brain-gut dysfunction. That is how the disorder is defined. So your brain does not communicate properly with the enteric nervous system of your gut, which operates independently from your brain and your spinal cord, but there is also communication. In return, the enteric nervous system of your gut doesn't communicate properly with your brain. Right. So you've got miscommunication, you've got misinterpretation of what may be normal signals coming back and forth. You may have abnormal signals going back and forth. You end up with this huge mess of your brain affecting your gut affecting your brain, and the whole entire cycle is just dysfunctional. And that is what leads to the awful symptoms of IBS and the bowel dysfunction and the pain. So you really have to try to break this cycle. If you can get yourself stable, it's much easier to keep your gut stable. It's harder to get stable in the first place. But you know, she's spot on. Anxiety absolutely triggers IBS. IBS absolutely triggers anxiety. This is where you really need to break the cycle. And I would want to get her some pretty in-depth dietary information, because I would guess that it's not really everything or anything she eats. There's probably some specific things setting her off. But just as importantly with IBS, it's not just the foods that you have to avoid and the trigger foods. It's also learning your safe foods, and in particular the whole category of soluble fiber, which is sort of your best friend if you have IBS. It's the bowel regulator. It normalizes motility, it regulates contractions, it resolves diarrhea and constipation. It will prevent pain, spasms, and cramps. People with IBS need to learn that they can eat without fear. They can eat things that will actively help them, so they're not always afraid. If they can gain that confidence and learn the underlying reasons why, so they have faith in this, there's logical reasons why soluble fiber will help you with IBS. It gives you a safety net. It gives you something that you know you can eat a little bit of under any circumstances all day long. Just keep your gut filled with soluble fiber foods. It will give you a safe foundation. It will let you break the cycle of IBS. And you can literally break the cycle and do nothing but soluble fiber foods for 2 or 3 days, 3 or 4 days if you're in really bad shape. It's boring, but it's going to calm down your gut. It's going to stop the spasms and cramps. It's going to stop urgency and diarrhea. It's not going to flip it to constipation. It's just going to get everything calm back to a stable midpoint. You can then keep it calm and expand your diet from there. And then you can start eating without fear. So there's a lot that you can do to stop the chronic diarrhea, to prevent it, so that you're not constantly afraid of that. And it's not just learning the things that are bad and that will set you off. It's learning the things that are good and that will actively help you. And that in turn really reduces your stress and worry level, because you're not so anxious. You're not just left in the dark wondering, is this going to make me sick? You're going to know, oh my God, I'm not feeling well. I can eat this. It's going to calm things down and get me better quickly. I have safe foods now. I have things I can rely on. That is a world of relief to so many people with IBS. It's really a key part of treating the symptoms and getting it under control.
So Heather, okay, yes, I don't think anything's boring about the tummy. Speaking of eating soluble fiber, but we have a special for soluble fiber. It's our special number 2, which is the tummy fiber bundle. And that is 25% off. And that, of course, ends tonight at midnight. And you just explained the necessity of living in a soluble fiber. Basically, the way you're eating is through lots of soluble fiber.
That is the only category of foods that will actively help regulate motility and resolve both diarrhea and constipation. So you can add in soluble fiber supplements like the tummy fiber. A lot of people need that extra amount of soluble fiber. They can't get it through foods alone, but don't let that discourage you from changing your diet as well. It's really critical that you are getting enough soluble fiber from your foundation foods to keep your gut stable. I think dietary changes are really the key to managing IBS, knowing your safe foods, your trigger foods, how to eat, not just what to eat, and then adding on things like soluble fiber supplements or peppermint or fennel if you need them for extra help. But it's really key to get your diet straight in the first place and to understand how foods physically affect your gut for better or worse when you have IBS. The more that you can learn about that, the more that you have power and you have information that you can use to your advantage.
That leads us right into Mona's question, which is her biggest frustration is explosive diarrhea, no matter how careful she is. She says, I don't think anything, her explosive, so it's not just diarrhea, it's explosive. So that is
Yeah.
what she's dealing with.
And that shows you how incredibly severe the spasms and cramps can be for people who have IBS. Explosive diarrhea is because her gut is contracting so hard and so fast, it is rushing everything through it so quickly. You can imagine the pain and the spasms and the level of agony that can come with that kind of muscle contraction in your gut. Imagine having that in your leg. It would be a Charlie horse so severe it would cripple you. You couldn't walk. That's what people with IBS deal with in their gut. So the explosive diarrhea is a function of those incredibly extreme spasms and cramps and often blinding pain that comes with it. This is another situation where you have to break the cycle. You've got to get your gut calmed down so that it stops these spasms and contractions that are going awry, and it gets into a rhythmic, normal, stable mode of motility. That's where you're going to have to rely on soluble fiber. Mona is probably someone who she's going to have to take several days and just literally not eat or drink anything but plain soluble fiber foods. Mm-hmm. Hopefully as much strong peppermint, fennel, chamomile, ginger tea as she can to add on to the calming and the soothing, the antispasmodic effects. She's basically trying to gently force her gut into normal motility, which just plain soluble fiber will do. Give it a couple of days to get into that stable rhythm. Keep it filled with soluble fiber so you keep the stability, and then start carefully expanding your diet. There's a wealth of information behind this. There's a lot of details. What are soluble fiber foods? What are the triggers? What's insoluble fiber in the mix? So I'm sort of giving a nutshell version of how you can get this under control, how you could break the cycle of attacks. Mm-hmm. But you would not be in the dark about it. There's a ton of information to follow and guidelines, and it can become a second nature way of eating so that you start preventing these attacks. You're not constantly trying to get stable. You're now in the mode of staying stable. And you can actively do that day after day. The longer you stay stable, the easier it is. So it may take more of an effort to break that cycle and to get stable, but once you are there, then you can move forward, and you should not have to deal with explosive diarrhea every day. That should not be a part of your life. There are ways to deal with that and get that under control if that's stemming from IBS.
Great. And so we're all about breaking that cycle. And y'all, as you can see on our thread here, we do have links. Heather has given us so much information on not only how to live, but how to live stable. There's information overload. Just start clicking on there and start educating yourself so you can get to that point of living in that free zone. And it's possible. Heather's been doing it for 40 years. And so if you're new to our community and you're new to starting to reach out for help for IBS, we do have our third special that again is going to be ending tonight at midnight. A link is in, we have a link for you to click on to get right to it. It's the Diet Kit Starter Kit Bundle. I love this. Heather, can you explain a little bit about what's in this bundle and why it's great for starters?
Sure. This is the diet kit, and it is helpfully, I think, particularly for people starting out, because it's got the book Eating for IBS, which will give you all the dietary information. It literally has a chapter called Breaking the Cycle.
Love it.
What to eat when you can't eat anything. And the original title for that book was not Eating for IBS. It was Eat Without Fear.
Okay.
That was my working title for the book, and I think it's still a really accurate title because it conveys exactly how people with IBS feel. They are afraid to eat, and I really wanted to get them to the point where they could eat without fear and then live without fear. Right. So that's the whole point of this book. What can I eat? What can I eat? How do I eat? How do I live with this and still have really good food and a good life? So that is a really helpful tool for people starting out. Or if you've been dealing with IBS for years but still don't have it under control, it's going to help you as well. You still need that dietary information. You need that foundation. That particular diet kit adds in a canister of the tummy fiber, which is extra prebiotic soluble fiber. So that again is your bowel regulator, diarrhea, constipation, spasms, cramps. That is the thing that's going to smooth out all of those issues. And then it's got a couple of bottles of the tummy tamers, which are the peppermint and fennel oil. Those are great for quick help with preventing the pain, the spasms, the cramps, the bloating, and the gas. So typically the extreme fear with IBS comes from people who are hit hard by pain and urgency and the explosive diarrhea. That's where they really end up living in fear, sometimes unable to leave their house. They're so afraid.
Absolutely.
Yeah. So you got to break that cycle.
Yep. Well, we have definitely.
And you can.
Go ahead. Yes, and you can, and you have a resource. So there's, getting out of that frustration in the dark and just educating yourself. So you have that resource. We have then now, Heather. This question comes from Robert. He's so I can sense Robert already. He's so sweet. Everything is in caps. So I just want you to think about this question coming to you all in caps. Okay. It says, "Dear Heather, you want to know my biggest frustration? 3 exclamation points. After over 41 years of IBS, it's hard to say what the biggest is. I guess at age 65, I never realized my potential. IBS saps all my time and energy." So he's really mentioning about how it takes his time and his energy.
Yeah, it does, because people spend every waking moment wondering if they're going to get sick, afraid of being sick, living in fear of being sick. And that's where their focus, their time, their work, their effort goes. And I'm so sorry, Robert, that you've been struggling with that for so long and have been dealing with it for so long, because that's not right. And you should have been given a lot of help a long time ago. There's certainly still a lot of changes you can make. It doesn't really matter how long you've been struggling with this. You can still break the cycle and get your gut back on track. IBS is a motility disorder. It's not a disease, so it's something that you can manage. It helps to, you really have to educate yourself, learn what's going to help, what's going to hurt, and then take the time and energy to focus on, really, I would start out with your dietary changes. You're going to have to think in advance, what do I need to eat that's going to keep me stable, and be focused on that day in, day out, so you are constantly keeping your gut calm. It will take less time and energy to do that as you go along. It will become second nature. It won't take as much work, but it's a way, to channel the time and work and effort you're already putting into worrying about being sick, into actively getting yourself stable so that you're not sick. So it shouldn't take any more time and work. It's just going to channel in a different direction that will get you stable and keep you stable. And it can happen. It's not that difficult. It does just take some education, information, and then making the effort, asking questions, getting your dietary basics down, soluble versus insoluble fiber, avoiding the big triggers. But you can break years of the cycles of attacks. You can get yourself stable and then stay stable for many years. I actually had a woman call a couple of days ago, and she had been stable for many years from the dietary changes, but she had suddenly had an attack and a setback, and she was feeling discouraged. And so she had contacted us, and she knew why she had gotten sick. She'd kind of fallen off the wagon, and she started eating a lot of cheese and some raw green salads, and she knew those were her culprits.
Okay.
But she was feeling kind of down because she'd been stable for a while, and now suddenly IBS had come back. And I had to tell her, I think you're looking at this in the wrong way. You're feeling dejected and discouraged, but really, you should be so proud of yourself, and you should be so happy, because you got yourself stable for years on end. You got yourself so stable that you actually kind of forgot you had IBS, and you forgot that you can't eat like the average everyday person out there. And that's why you started cheating and you fell off the wagon. You actually had the confidence of your body and health and your life to sort of forget that you had IBS. And that's what led to the flare. So you should be really proud that you got yourself stable. You stayed stable for so long. You got things under control for so well, to such a great degree.
Yes.
And now on top of it, you've had a flare, but you also know exactly what caused it. You're not in the dark. You're not wondering. You know it's because you started eating cheese. You know it's because you started having raw green salads and insoluble fiber on an empty stomach. And now you have to crack back down, get your diet under control, and you'll be stable again in a day or two, and then you can move forward.
Yes.
And she laughed, and she said, yeah, You're right. That's exactly right. And I am proud. I hadn't thought
Yeah.
about it that way, but you're right. It had been so long since I had really actively forgot about IBS, worried about
Oh my
IBS.
goodness.
I just
That's
started to take it for
great.
granted that I was stable day in, day out. That's the point that you want to get to. And you can get to that point, and then you can stay stable and move forward. So
And
hang in there. That can absolutely be done.
there's nothing there, you can't put a price tag on the feeling of knowing I actually have the answer. And that's what your community is
Yeah.
all about, is empowering
Yep.
people with the answer, because it's, if it happens, it happens. You know the answer. And if you're not quite there yet, you're going to get there. The resources are
That's
here
right.
for you to get there.
That's right. And you might
Yeah.
still get hit out of the blue.
And that's
IBS can be
okay.
unpredictable.
It's
That's okay. At
and that's
least
okay.
maybe you can pinpoint what did it. Maybe you can't, but now you have the answer to get back on track, to get stable. The more information, the more education you have, the better. You can't know too much about what's going wrong with your body when you have IBS, because then you can know how to fix the symptoms, how to manage it and get stable.
Right, and that actually then starts bringing down that anxiety level,
Oh
because
yeah.
that's the number one thing. So all you newbies out there, not only hear you, we feel you, but we're here to let you know that is going to change. The more you
Yeah,
educate
absolutely.
yourself, it is going to change. And thank you everybody who's been doing comments on here. I'm trying to look down and chat and all this fun stuff. So let me just do a shout out, which Maravilla had stated, which we've been talking about. I'm going to read her question. It just says, I fear taking soluble fiber powder, thinking it will give me diarrhea. Her question, she puts a sad face, and then the question is, what foods have soluble fiber? Is it in your book? A, yes, it's in the book, but B, this is, I think I see it, everyone, I'm in the community, making sure there's no trolls in there, keeping it real, and just high-fiving all the wonderful support that's going on. I see this over and over, Heather, is that they talk about the fear of the soluble fiber. Even when they realize that it's
Yeah.
fiber, it's still in their mindset. It's kind of like you need to change that conversation, because of just, again, it's just the fear. But so she knows that she
Yep.
should be taking soluble fiber. So it's what I'm hearing you say, Heather, is start changing the conversation of, instead of I fear taking soluble fiber, it's how much soluble fiber can I get in my gut? Would that be safe to say?
Yeah, it can only help you. And there's so much misunderstandings about fiber. And to this day, I still hear from people whose doctors tell them, you have IBS, take more fiber, eat more fiber. That is the worst piece of advice. What
Okay.
kind of fiber?
Exactly.
When most people think of fiber, they think of roughage. They think of raw leafy greens and popcorn and wheat bran. That's all
Ugh.
insoluble fiber. That's a huge IBS trigger. It's a GI stimulant. If you have IBS, it can set off spasms and cramps. It can trigger diarrhea. It can make your gut motility sort of seize up in a Charlie horse, and now you've got constipation. So insoluble fiber, you are going to have to be really cautious with. That does not mean that you don't eat those foods, but you're going to have to eat them carefully. Literally, insoluble fiber doesn't dissolve in water. That's what the insoluble part means.
Okay.
So soluble fiber, completely different class of fiber, it does dissolve in water.
And your gut
It's
wants
found
it.
in foods. Your gut needs it. Everybody's gut needs it, whether they have IBS or not. If you don't have enough soluble fiber in your diet, you are not going to have normal bowel motility. People with IBS just need more of it because their gut is more prone to go awry with spasms and contractions.
Good.
So soluble fiber, most people don't actually think of as fiber at all. It is found in foods like rice, bananas, potatoes, oatmeal. Soluble fiber literally dissolves in water. Soluble fiber cannot make diarrhea worse. It cannot make constipation worse. Soluble fiber literally is a bowel regulator. When it's physically present in your gut, it forces normal motility, the peristalsis of the gut. It also regulates water content in the bowel. So it will resolve diarrhea or constipation, both. It will stop spasms and cramps and turn that into normal rhythmic contractions that aren't painful. There is a catch. You need enough soluble fiber physically present in your gut to force that normal motility. Until you get up to that level, other things are still going to come along and trigger symptoms. So if you're adding in a soluble fiber supplement, like the tummy fiber powder, you have to start at a low dose twice a day. You have to increase gradually. It's probably not going to do anything for you when you first start. It's not enough in your gut. You're just getting your gut used to more fiber. It can't make you worse, but it can't make you better until you gradually work your dose up enough that you get to the point there is literally enough of it in your gut to force normal motility. So I can't say it enough. Soluble fiber cannot cause diarrhea. Soluble fiber cannot cause constipation. It can't flip one to the other.
Okay.
All it's going to do for you is regulate bowel motility and water content in the bowel, which will really help resolve and then keep at bay all IBS symptoms. But it won't do that until you gradually get enough of it in your gut. So learn to rely on your soluble fiber foods. Those are your safe foods. You do not want to be afraid of them. They will actively help calm down your gut. Once you get the security of knowing that that can help you, now you've got something to rely on. You've got something that's going to be an anti-anxiety eating approach for you, something that will keep you calmer, less stressed out. That will then get your gut calmed down as well, and now you can expand your diet. So use your soluble fiber as your safe foods as the key to mitigating all of your symptoms. Don't be afraid of it. It can only help you.
As clear as can be. And if you're listening to this maybe on a repeat, rewind this part until you get it into the mindset, because we see that a lot on our community is people's fear of the soluble fiber. First of all, not knowing the difference between the two, but here's the explanation. And then as you can see, and thank you for seasoned IBS user who chime in, letting the newbies know, hey, I too experienced this and I followed the directions, and it takes time. Take the steps, and here's the explanation to everybody as to why you're taking the steps to start slowly. That's just the way it works, and just allow
and
it to
have some
work.
patience too. You know, if you've had a dysfunctional gut for years on end, it's not realistic to think that that's going to turn around in a matter of hours or days. Diarrhea, you may well turn around in a couple of days, certainly a couple of weeks. Pain and spasms, you can maybe get on top of in the first day or two. That can be pretty fast to resolve. The pain, the spasms, the urgency. If you've had chronic constipation for years on end, that's not going to get better overnight. You're not going to take soluble fiber and be all better in 2 days, probably not even 2 weeks. 2 months? We can do a lot in 2 months.
And it's the daily,
it's a daily
occurrence of working that. Here's a good one. I read somebody had stated this, and I've heard this a long time ago. It's, okay, our bodies, it takes time. It's already at the stage of having the symptoms. You're there, you're having the pain. And somebody explained, it's like being pregnant. Once you have the baby, you're not pregnant anymore, but it takes a while for your body to get back to the way it was before. So IBS is the same way. It took, it has this buildup, we're dealing with it, but once you start getting better, it takes a while. It doesn't instantly, your body doesn't go, whoop, baby's gone, body's back to the way it was 9 months prior.
Exactly. Something has been dysfunctional with your gut day in, day out. It's been behaving abnormally. You're trying to get it to behave normally, which you can do, but you probably can't do it like that. That's just not being fair in what you're expecting of your body.
Exactly.
So pain and spasms, bad in a day or two, you should be able to get much better. Diarrhea, maybe a couple of days to a couple of weeks, that's fair. Constipation, a couple weeks to a couple of months.
Couple of months, definitely keep that as...
Especially if you've been using laxatives, add on to that, because you're going to have to make a gradual transition off of it.
Right,
so
and there is a lot of talk about that.
Not overnight.
Yes.
Yeah. You should feel better along the way. You'll start feeling better. You'll see improvements, but it's not like you're just going to turn the Titanic around overnight. It doesn't work like that.
Right, exactly. We're about to wrap this up, but Barbara, I've been seeing you interacting here quite often. She has a neat question about traveling. So maybe Heather, you can share some tips on this. Traveling is a big fear, especially when you stay over at other people's homes. So do you have any, living fear-free with the IBS, do you have any suggestions on?
Yeah, there's a ton of info on the websites about that. There's actually a ton of info in both the books, because that comes up a lot. How do I travel?
Yes.
You may have to make the IBS a priority for that. You may have to do a lot of planning in advance, taking your safe foods, taking your supplements with you, scoping out where and how you're going to eat when you're on the road and once you get there. If it's really stressing you out to stay at someone else's house, do you have to? Can you stay at a local hotel and then take that fear factor out of the equation? Can you control where or how you're staying in their house? Can you talk to the people so they understand your needs? Is it that you need a private bathroom? What's the underlying fear here, and how can you address that before you even get there? So a lot of the issues with travel are planning in advance and making sure that you have the things you need to stay safe and to stay stable before you even get there.
Well, I'm definitely hearing the Diet Kit Starter that has the book, has some products for the 25% off, is extremely helpful for a lot of the questions that are coming up here. We have another
Yeah,
live question for you, Heather. It comes from Yvette. Yvette is asking, how are UTIs related to IBS and why, and how to prevent?
well, they're not directly related in that IBS is the underlying disorder is going to lead to UTIs, or UTIs would lead to IBS, but it can go both ways in sort of a peripheral manner, in that if you have a UTI or if you have any other illness, it can set off IBS. Anything that physically stresses your body can trigger IBS symptoms. A cold, the flu, just a lot of stress in your life, or a UTI, anything else that's negatively impacting your body can set off IBS. It's a stress factor.
That makes sense.
For some people, particularly with more the diarrhea end of things, that can make women more likely to get UTIs just from the external bacterial contamination. And women are more prone to UTIs than men because they have shorter urethras. So there's not very much length for bacteria to travel up into the urinary tract. Really, the best way to prevent that is to try to get the IBS under control so you don't have the diarrhea and take that out of the equation. The other thing that you could add on, if you are just prone to chronic UTIs, some women are, despite their best efforts, even if they don't have IBS, there's something called D-mannose that you can add in. It's a really safe, old-fashioned supplement. It's just a plain white powder that you can get from health food stores. There's no downside or risk to it. It will not hurt IBS. You just dissolve it in water. It doesn't really taste like anything. And it has been clinically shown to help prevent bacteria from sticking to the bladder walls or the urethral walls. So that can actively help prevent urinary tract infections in the first place. So that is something to look into that would help prevent the UTI and will not affect IBS at all.
Okay, but thanks for the clarity that it doesn't lead to one. It's just you happen to be dealing with that.
Yeah, they can overlap or maybe make you more susceptible, but there's nothing to show that the gut dysfunction of IBS would somehow increase your risk of a bacterial infection in your bladder.
That's great clarification, because that would throw someone off. So great question. Thanks for asking that while we're here live. And I have another live question for you, Heather.
Sure.
This actually, I see positive in this, but this is just a little bit more in depth. So the question is, I have suffered from IBS all my life. I have been using all of your products for the last 5 months. Yay. Eating all the right food and exercising regularly. So she's doing all the right things. But I still get attacks, not as frequently. My biggest concern is that I suffer from several bloating, and it's very painful. So that seems to be what she's dealing with towards the end here as she's figuring out what works best. And she says, I use both your peppermint and funnel tea, but no relief. What do you recommend? So she's doing a lot of things right.
Bloating tends to be the most difficult symptom for people to get on top of. And it can be the most frustrating and the most upsetting in a lot of ways. It also seems to be really tied to constipation. So if you can relieve constipation, that can actively help the bloating. So if you still don't have the constipation totally under control, continue to gradually increase your soluble fiber. You may end up on a high dose of that for constipation. That's not unusual. But getting the constipation under control should really then in turn help the bloating. The other thing you can do with the bloating is overwhelm it with the fennel. Instead of having just a cup or two a day, spend a couple of days, drink as much of the fennel tea as you can.
Do you have IV? You're sick of it. Come on, do you have IV fennel? Come on, Heather.
Yeah, it's it'll get on top of it.
Yeah.
I wouldn't. It's just a process. You're basically trying to kind of overwhelm your gut with the carminative effects of the fennel. If you can do that for a couple days, that should make a big improvement, and then you can drop down to a reasonable amount. Make sure you're not doing something to inadvertently trigger bloating, like any kind of carbonation, chewing gum. Drinking with straws can cause that for some
Yes.
people. Eating too fast, so you swallow air. So try not to eat in a rush. There's a combination of things you can do for bloating that is one of the most frustrating symptoms for people. It's, I think, probably the last to go,
Oh, this
usually
is good
because
news.
it is tied to constipation. Yeah, so if you can get rid of the constipation, you should see the bloating dissipate. The prebiotic effect of the tummy fiber can actively help bloating. That takes about 3 months to kick in. You have to give healthy bacteria a chance to colonize your gut. So again, bloating is kind of the last of the things to go for a lot of people,
Well, then I
unfortunately.
I actually am seeing her question as a huge positive thing, and the fact that it does take time. So it's neat to see she's kind of like at the finish line, as far as
Yep, and you
getting
should
it
see
into.
improvements as you go. It's not going to be overnight. You know,
Right.
you're not going to go from horrible to perfect, but you should see improvements. Things should get better. Oh my gosh, there's less pain. I'm not getting hit by these attacks and these spasms. Oh, the diarrhea is resolving. Oh my gosh, the constipation is starting to improve, and now I can see that that is resolving as well. And as that goes down the road, the bloating should get helped as well. So you should see improvements as you work through the process.
And Heather, I didn't even say this correctly. She has the IBS-C constipation, just IBS, and I read the rest of it. And you knew exactly, because of the bloating, because of her symptoms, you knew it was actually constipation. So I thought that was pretty interesting.
Well, yeah, it's very interesting. I haven't seen anything in the clinical research that ties them together. They don't usually lump the symptoms in that way. There's just a spectrum of symptoms.
Okay.
But just in talking to so many people over the years,
Yes.
the severe blinding pain really seems to go with the urgency and diarrhea.
Gotcha.
And the bloating seems to really go with the constipation. That's
That's
not a black and white. You can have symptoms
sure.
overlap, but in general, the extreme pain folks are the diarrhea, the extreme bloating folks are the constipation. So,
That's helpful.
resolving any
That's
one of
helpful.
those issues is then tied to the other symptoms. So
That
helping one thing with IBS should help all of them. You're not using different treatments for diarrhea and something different for pain and something different for constipation. The same dietary changes, the same additional dietary supplements to your diet, they're all going to help the whole spectrum of symptoms. It's all tied together. You're just regulating gut motility.
Right.
If you can get that under control, it's going to help all of the symptoms across the board.
Oh, I
That's
love
your
it.
goal.
I love it. I love it. Barbara has another chimed in with another comment here. Again, thank you, Barbara. This is interesting. Heather, during an attack, is there any way to get relief? So during the actual attack, what is your suggestion?
Okay. Hopefully you have somebody to help you if you are hit hard by an attack, because you may be immobilized with pain. So a couple different options here. If you can get peppermint oil into your system as fast as possible, it's an antispasmodic and a painkiller. If you can get some high volatile oil peppermint tea brewed black, and I mean black, as strong as you can possibly brew it, start sipping that. You're trying to get peppermint oil basically into your system through your mucous membranes as fast as possible. So you can't do something like take a peppermint oil capsule in this situation. It's not fast enough.
Okay.
If you can't get to high volatile oil peppermint tea, you're in the car, you're in the bathroom, you can't move.
Right.
Your next step, try Altoids peppermints.
Okay.
Literally keep little tins of the Altoids Curiously Strong Original Peppermint, the red and white tin, not the
Yes.
sugar-free, not any flavors. If
Okay.
you read the ingredients, it's going to be like peppermint oil, sugar, and gelatin.
Okay.
A lot of peppermint oil in those things. They're strong. Start chewing them 2 at a time and just keep chewing them. You may have to chew like 10 or 12 of them. It's not pleasant. It's not fun. You're not going to care because it's going to help stop the pain quickly. And again, it's
Wow.
getting peppermint oil into your system through the mucous membranes in your mouth. I keep peppermint Altoids in my bag. I keep them in the car. I keep them in the bathroom, like
Yes.
within reach of the toilet. So if I'm caught in a situation where I can't drink the peppermint tea, which is the best, I will go to the second best, which is the Altoids. Just keep chewing them until you get relief.
On my
Third
shopping
option,
list.
if you live, yep, add them to your shopping list and get them in bulk at Costco. Third option, if you live in a medical marijuana state, look into that. There's growing clinical research on CBD and also THC. Play around with that. Get a prescription from your doctor for the medical marijuana and start talking to people about what the options are that could help you. The one big advantage with that is that there's inhalant and there's sublingual, which are like under the tongue forms. So they get absorbed into your system very quickly. That's what you're looking for when you're in the midst of an attack. You need something that's going to get into your system and act as an antispasmodic and a painkiller as fast as possible. So if you have that option in your state and you're interested in trying it, that might be something that can give you really fast relief from the pain and the spasms and just stop that agony.
Great, great tip. Great tip. So thank
Yeah.
you for sharing that one. We have another live question here. You doing good, Heather?
Yeah, and after this, I think we need to wrap it up.
Okay, I just wanted to chime in. Well, and thank you everybody who's watching right now and giving us your questions. It's really helpful. Okay, it says, hi, my doctor prescribed, and I don't know if I'm saying this word correctly, so I'll spell it, but I'll try to say it, Xifan, Xifaxan, for diarrhea. What is your take on this, question mark?
Xifaxan, it's an antibiotic. It's not for IBS, it's for SIBO, which is small intestinal bacterial overgrowth.
Okay.
So some people with IBS don't actually have IBS, they have SIBO.
Oh.
You should not be diagnosed with IBS until your doctor has ruled out SIBO.
Okay.
You should not be given antibiotics for SIBO just because you have IBS. So check in with your doctor. They should have done a breath test, which is how they diagnose the bacterial overgrowth. If it comes up positive, they will give you the antibiotic to try to wipe out the bacterial overgrowth. If you don't have the bacterial overgrowth, ask them why they're giving you that drug. You should not be taking antibiotics if you don't have the bacterial overgrowth. They should also really clarify with you that that antibiotic is to treat SIBO. It is not to treat IBS. With IBS, there is no underlying infection. It's a dysfunction. It's not a disease. Two different things.
Okay.
You can have SIBO and IBS both, but just because you have IBS doesn't mean you have SIBO. So you need to ask your doctor some questions about why they're having you take this drug.
Exactly. That's the number one thing. Even though, yes, they are a doctor, you need to be very clear and not just assume.
Yeah, I mean, do you have SIBO? Then that's the appropriate treatment. If you don't have SIBO or they didn't even test you for it, why are they giving you the antibiotic for it?
Wonderful. You guys, thanks again so much for chiming in with your questions, being interactive. Heather, beyond thank you for your time and, of course, all of your knowledge that you are just pouring into everybody to help them to live, you know, stress-free and not having fear living with IBS.
Yep.
Greatly appreciate that.
Yep.
And remember, everyone, we do have these bundles that are put together specifically to help you out, an extra 25% off. It's our 16th year anniversary, so we're saying thank you, thank you. Definitely want to take advantage of that, and the links are in the comments below, so you can go ahead and click on that. It does end, you know, it's a special, it's going to end, but definitely take advantage of it for you to help you. And it ends tonight, so go ahead, and if you're thinking about it, this would be the time to do it. Again, Heather, your time, your expertise, again, is greatly appreciated. And everybody out there in our community, thank you for keeping it private. Thank you for being respectful to one another, encouraging one another. And I think I read this all day long, Heather. I'm so glad I'm not alone, because you're not alone. We're in here.
No, you're not.
Yeah, with you. Look at these tips Heather just shared with you this evening. Just flying off the top of her mind, because she's dealt with this year in and year out. And so reach out, ask questions, and definitely start changing the conversation of when I can get this under control. And get in there and get yourself educated. Heather's put this information here for you to get you there. So go ahead, and we're going to chime out. And again, thank you. And definitely leave your comments below and check on the links. Well, goodbye for now. And thank you, Heather.
Thank you so much.
Bye-bye.
Bye-bye.